When a patient's timer goes off and they're ready to come off of their initial setup, the best thing that you can do is shut off the timer, walk directly to that provider and say, hey, John's heat just went off. Would you like me to get him ready for you, or should I take him to his first exercise? Now, I would encourage you to have a plan for what that first exercise would be. Our best flow as a provider is to always take our patients first. That will keep us into our flow, which keeps our patients into a better flow, which keeps you into a better flow. However, there are circumstances when, even though it seems we might be prepared to take that patient at that time, for some reason, we're not ready to take that patient just yet. So please come and anticipate that by offering a suggestion as to what exercise you'll start them on. Have a game plan to either get them ready for the provider or to get them started on exercises. If the provider elects to have them start on exercises, feel free to ask the following question. How many exercises do you think you'll need before you'll be ready to treat them? It's a great question that will help you be able to keep the flow for that patient and that provider that day. Even minutes can make a huge difference to a flow of a provider. I've had it happen where I haven't done the best at communicating my needs to our support staff. And when I come out, a patient will have just gone on another exercise, and it might only be for 2 minutes. But those might be 2 minutes that are super valuable. Consider this, if that happened with the first patient of the day, and then every patient thereafter, and I see 19 patients in a day, each of those 2 minutes adds up to nearly 40 minutes that I'm behind. That's more than the whole block of window that I have to see a patient of 30 minutes. And that will lead a provider feeling overwhelmed, behind on their day with their patients, and behind on their notes, which impacts the feeling of the whole team. Work a little bit to make sure that you're on the same page with that provider, so that way we can maintain that flow. And even though there might be instances where you notice that a provider looks ready for a patient and they elect to delay the hands-on care until after a few exercises have been performed, if you work to communicate how many exercises or how long that patient should be exercising for, then we can make sure that we can still stay ahead of that flow and allow that provider and our whole clinic to run like a well-oiled machine.